done by Dr. Narula, Professor Narula, otorhinolaryngologist, working in Cambridge and now in Middlesex University.
I think so, yeah. Like a cochlear implant. Thanks, I'll get it.
Plaidoyer pour le changement, directive sur le temps de travail, dispositifs médicaux.
Monsieur le Président, Mesdames, Messieurs, merci bien pour votre invitation. Et merci pour votre hospitalité, mes félicitations. Après le déjeuner, c'est très magnifique et maintenant je vais dormir. Au revoir, mes amis. Non, ce n'est pas. Mon français, c'est très, très mal. Cette lecture en anglais, s'il vous plaît. Pardon. Nous voudrons changer les règlements et nous voudrons avoir 65 heures chaque semaine. 65. S'il vous plaît. We wish your support. En Angleterre, it is not working. It is not working. Ici, 80, les assistants, c'est très mal. Les chefs de service, 50 ou 80%, c'est très mal. C'est incroyable, c'est impossible. We do not have enough. Il n'y a pas suffi de médecins pour travail. Our care is getting worse. There is poor availability of staff and not enough staff. We are suffering, and our patients in England are suffering. Also, the training is bad. There are fewer hours for the assistants. They have less time. They meet the specialist for less time each week. And also, les assistants sont désolés parce que le résultat n'est pas plusieurs avec la famille. Okay. The system is broken. En Angleterre, chaque mois, 400 000 heures sont perdues. Chaque mois. In England, we have the government gives targets for treatment. 18 semaines. We cannot manage the targets because of the reduction in hours. C'est très difficile. 2009, our survey, 62% chirurgiens are working above. Not yet work. 80% consultants, 66 assistants. The patient care is getting worse, and the time for training is decreased. Also, c'est très cher. Très cher pour les médecins temporaires. Ici, 150 millions d'euros. Et maintenant, 300 millions d'euros chaque année. C'est incroyable. Aussi, encore plus de maladies pour les chirurgiens. So they have less time at work and they have more illness. They are not happy. They are no longer happy. A big major report in England, Professor Sir John Temple. He agreed that it's very difficult to train. 48 hours, it's not enough. If you tell me, I'll say it in French. What do I need to say? Okay, so that's in the title, yeah? It's on the... Le réglementant européen sur la chirurgie. Oui. So 48 heures chaque semaine. Et c'est la même chose ici en France, oui? 48 heures, oui. Oui. C'est la réglementation européenne, c'est la même chose. Peut-être la même chose. Okay, we are in France. And it's very difficult for high emergency specialties. General surgery, orthopedics, very difficult. Neurosurgery, very difficult. So in England, we have a new government. 2010, new government. And they promise us they will do something. À ce moment, il fait rien. Absolument rien. Like all politicians. Monsieur Sarkozy, Monsieur Royal, they're all the same. I don't know. They're all the same. Our government is looking at a way of changing the contract for trainees. It's very difficult. The trainees are paid very well in England, very high salary. Not like in Germany, where they get paid very badly. And they don't want a new contract. This will mean less money. In the EU, ici en France, 48 heures peut-être, je ne sais pas. Allemagne, 48 heures peut-être, je ne sais pas. Irlande, non, pas. Irlande, pas. Greece, Greece est terminé. And in America, 18 heures, c'est parmi 18. Pardon, 80, 18 et 18, monsieur, pardon. 80 heures chaque semaine, c'est parmi. Aussi, in America, when the assistant fill in the form, the chef de service has to sign. If they do 98 heures, they write 80 seulement, and the chef de service will sign. En Angleterre, no, we don't see. We need to work together. My friends in France, we need to work together. Ensemble. Now in Brussels, they are discussing. They talk. They talk a lot. Nothing will happen. Nothing will happen. Even the topics not yet agreed. Okay? Nothing will happen. We have to make more noise as surgeons together, particularly Angleterre, France, and Allemagne. We propose the règlement européen should be modified. The patient is more important than the number of hours. Oui, chirurgien, c'est différent. Tous les médecins, non, nous sommes chirurgiens, c'est différent. And we all need to work together to strengthen training and the good of the patients. Monsieur le Président, un peu en français, un peu en anglais. Merci, monsieur. Merci, mesdames, messieurs.
Il faut parler fort, mais...
Voilà. In February, yeah, 2004, oui. Bruxelles. Yeah, yeah. 48, oui. No. Libre, oui. Non, non, libre, libre, oui. Le jour suivant. No. No, but maintenant, is it applied now? Is it applied now? 48, is it applied? Non? Non? En Angleterre, it's applied.
Une question, Guillaume Bozio, qui est le plus jeune d'entre nous ici, qui est assistant chef de clinique dans le service, qui prend les gardes à l'hôpital Eduario, peut peut-être dire quelque chose de plus sur le rythme journalier et le rythme de la semaine à Lyon. En anglais.
Yeah.
The patient needs us to be present at each time of the day or the night. But the administration will not accept that because we have to declare our activity and that has a cost for the administration. We are ready to work free even the night. But in my opinion, the administration has to ensure we
Ça, c'est la même chose en Angleterre. C'est très difficile. So on Angleterre, it's different. If you work too much in Angleterre, you're punished with more money. So the hospital has to pay more money, much more money. And the hospital has no money, so they will not permit any extra hours because it is too expensive for them. It has been designed to stop it. 49 hours, 49, c'est trop expensive. Trop, oui.
When you work during the night, you are obliged to stay in your home the day after, or you can go to the hospital to do intellectual work?
You have to usually, normal, you go home around the déjeuner, approx.
Question of Richard.
A gap in France between surgical and medical resident, because surgical has Guillaume Bozo, but in the medical student, medical resident, often they want to have the security. Security, yes. In France, the problem now is the medical resident don't work after.
In my department, these rules are very well respected by the anesthesiologist, better than by the surgeons. Yes. You also?
Yes, I think I am a...
Your name.
Yves Matillon, I am a physician. Unfortunately, I'm not a surgeon.
Quel dommage, monsieur, quel dommage.
My understanding is the administrative world don't understand the job of the surgeons, and they are very prudent when they have a look on the job of the surgeon. And probably the relationship between the surgeon and the anesthesiologist could be interesting in order to understand the situation, the current situation. And I think the administrative people are very good friends, the anesthesiologists. And probably they say together, it could be very dangerous to work too much. And because it's dangerous, you don't have to work too much.
This is, if I can be clear, the Règlement Européen. This is not written in Europe because of safety of patient. It is written for safety of worker.
Something goes wrong and there is a medical legal situation coming up. And then, of course, the judges will say, big mistake.
Of course, this is completely true. I understand.
What Professor Derulo is saying about us working together, because we are working, we had a meeting with the German Surgical Society last year, and also they were very keen to do something about this. And I think if the French surgical community were to help, and we approached the politicians in Europe together, saying there is a major problem within surgery, then they may start to listen. But we're fragmented at the moment. In each country, we're fragmented because of surgeons and physicians not agreeing entirely about this. But if the surgeons of Europe got together and said, this is not appropriate, and for all the reasons that we said, we might be able to do something about it. Perhaps this is a discussion we can have when you come to London, I hope, in due course, and it's something that we can actually take forward, because we're putting a lot of pressure on our government to do this, but I think it will take more than just one country.
So, ensemble plus fort, Monsieur le Président, oui.
Il n'y a pas d'autres interventions, d'autres questions. Le temps est dépassé. Vous n'avez plus le droit de parler maintenant. Reposez-vous.